Well, I would tell my colleague from Texas, who has been a leader in this fight, asking for a budget, demanding a budget, that it is now today, as of today, been 1,111 days since the Senate has passed a budget, in spite of the law that says they must do so. This body must do so by April 15th of each year. So April 15th came, and April 15th went this year as it had last year and the year before, and yet there is no budget. So I look to the leadership of the senator from Texas, who knows how the hardworking families of her state and the hardworking families of my state resent the fact that Washington refuses to be accountable. The Democrats in this body refuse to be accountable to the American people. The American people, all they're asking for, in my opinion, is value for their money. They want to make sure that the money that they send to Washington is being spent effectively, efficiently, and they're actually getting value for their money. And I assume that's what that my colleague is hearing from Texas as well. Well, I would tell my friend and colleague from Texas, who is a wonderful student of this as well, that this health care law is bad for patients. It's bad for providers, the doctors and the nurses who take care of those patients, and it is terrible for taxpayers who are going to get stuck footing the bill. So it's not a surprise that this administration doesn't want to come to the Senate, is embarrassed to come to the Senate with a budget, because they know that the American people would be so much offended by the irresponsibility of and the nature of such a budget. And that's the situation we find ourselves in now. And as both my colleagues have said, with the Medicare, they took $500 billion from Medicare, not to save Medicare, not to strengthen Medicare, but to start a whole new government program for someone else, which is why when I travel the state of Wyoming and talk to seniors, they say, we don't like this health care law. It's why the health care law is more unpopular today than it was the day it was passed. But I do notice our colleague from Wisconsin has a new chart that I'm trying to read from here, and I was just going to ask if he could share what is up on that chart so that everyone gets a chance to see and hear the explanation.
Well, I thank the senator from Wyoming. Yeah, I came prepared with charts, and it's actually a number of things that have been already mentioned by my colleagues I'm ready for. We're talking about the true cost of the health care law. You know, when this
Well, I just want to, Mr. President, I just want to thank my colleagues who are here today sharing their time and their insight. And they have a lot of insight because they've run businesses. They've worked to actually meet a budget, live within the budget, have dealt with government regulations. And the senator from Texas was talking about these regulations. They're burdensome, they're expensive, they're time-consuming, hard to budget when you don't know what to expect. And that's what the American people who create jobs and who work jobs, they need some predictability, some certainty, so that they can make wise decisions. And when you have a Congress led by the Democrats in the Senate who do not pass a budget, the predictability isn't there, the certainty isn't there, there is so much confusion and uncertainty that people have a hard time making the longer-term decisions. And I know to my colleague from Wisconsin that that's what I saw in my medical office, and as I talked to my colleagues, and I know you had the same situation in Wisconsin. So I wanted to just thank my colleague from Wisconsin as well as colleagues from Texas and from Tennessee for their leadership and their continued efforts to try to get the Democrats in this body, in this administration, to pass a budget which by law they are mandated to do. And yet even today, now we're at day, 1,111 days without a budget, and to me that is inexcusable. So